Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back William Lynes. He's a urologist, and today's Kevin MD article is Teaching Medical Students What It Is Really Like to Be a Physician. William, welcome back to the show.
Yeah, thank you, Kevin. Thank you for having me back.
All right, so tell us what your latest article is about for those who didn't get a chance to read it yet.
Well, basically, it addresses the prevention of burnout by an educational program in medical school. Burnout is a major problem in America. It contributes to the decline in the quality of healthcare. And of course, we have an attrition rate of physicians, which is really of epidemic proportions. And so I believe that we need to address this by education in medical school. The term burnout was coined first by Herbert Freudenberger in 1977. It's interesting. He was a psychologist who, while he had a private practice, was also active in free clinics in the New York area. And he described what he called a syndrome, and he called it burnout. And it's probably likely that he was talking about himself, actually. And he talked a lot about emotional exhaustion. And since that time, the definition of burnout has expanded a little bit to three pillars of diagnosis, which would be emotional exhaustion, depersonalization, cynicism, and the third being a lack of personal accomplishment. And there's been a lot of studies that have looked at that across America. And really, like I said, it's an epidemic problem. Over 50% of physicians have some element of physician burnout. And tragically, it begins in training, very high incidence of it in training. And it's a mental illness, basically. And it results in suicide and suicidal ideation very, very commonly. Most people are familiar with the 300 to 400 suicides per year in the physician community. And, people have said, well, that's like a Boeing 747 going down every year, or it's basically one physician suicide per day. And, but if we don't really know about the number of suicide attempts in terms of reputable statistics, because suicides and attempts in general are traditionally underreported. But you could do a quick calculation of what you would expect in terms of suicide attempts by taking the number of suicides, 400, multiplying it by the number of suicide attempts per suicide in studies just in general. I put that number of about 50. So if you multiply 50 times 400, you get 20,000 suicide attempts predicted per year across the United States. And that's 2.5% of all physicians will be predicted to attempt suicide annually. And so I think that just gives you an idea of the magnitude of physician burnout. Now, what do you do about it? Well, right now, we're doing things like having mental health access and so forth for physicians. But if you take my case, those things were really too late for me. Beginning in 1998, I'm bipolar. I had two catastrophic medical illnesses. And, I was forced back, into the middle of burnout. And by the time I really knew I had a problem, accessing mental health and other things that were available to me were really too late. And as I look at it, I think that really medical students need to be educated about what the risks of the profession that they're going into, and from the standpoint of, if you do not take if you want to take excellent care of patients, you need to take excellent care of your own mental health. And I think that what I believe, because of the magnitude of the problem, is that we're looking at needing a institutional commitment to education, and I believe it should begin in medical school.
One of the interesting things that you wrote about in your article was that this continuous course of mental well-being, it needs to be taught by practicing physicians rather than mental health experts alone. Why do you make that distinction?
I think I always look back at my own experience.
Yeah.
And if, for example, I went to the University of Texas medical branch in Galveston, and they did a really good job in educating me in the mechanical things of medicine. But if they had occasionally said, well, you need to think about your own mental health, and maybe even had a class, and it was taught by intellectuals, I'm not sure I would have appreciated exactly what they're talking about. No, I think that the practicing physician who's down in the trenches, who really knows about what we're talking about, needs to lead the discussion. And maybe they don't give all the lectures, all the information. Maybe they invite guests from the therapeutic world, from psychiatric world, from professorships and so forth. But that's why I really, like I said, from my standpoint, that's who I would listen to.
So, what would that look like in terms of the curriculum? So, rather than having it be an elective or a once in a
Mhm.
while thing, you recommend it being part of the core continuous curriculum, right?
I do. I think that it's such a major problem that we need to commit our resources to it. Think it needs to be a significant chunk of the medical school curriculum. Basically, you need to take care of your mental health or you're not going to be able to practice medicine correctly. I believe it needs to be running throughout the entire clinical years of medical school. I think that the basic sciences years, maybe a little introduction, but the clinical years.
Hmm.
I think that it should be a course. I'm not sure it should be required. I don't think there should be grades associated with it, but it should be available really on a frequent basis. We in Galveston, we had a course that ran. I'm not sure where it ran, but it ran for several years on medical ethics. And so that was good. I needed introduction to it, but I'm not sure I needed a continuing course. I think we do need a continuing course that really introduces people to what the risks are of the profession that they want to go into.
In your article, you mentioned that a common thread for burnout is overwork. Why do
Yes.
you think medical culture is so resistant to changing that one core factor?
Well, I think that by the time you get into medicine, you're sort of bred
Yeah.
almost, just cultural. I mean, you think about it again. I go to my own, experiences. I mean, by the time I was in college, I was dedicated to spending every single minute that I could trying to prepare, trying to get into medical school. So I was an overworker even before I went
Mhm.
to undergraduate, but I certainly was as an undergraduate. And then, of course, you want to get into medical school, so you overwork. You want to get a residency, so you overwork. And once in residency, it's sort of built into the system, and then that spills over into your practice. As far as I think we're all open to having people who aren't overworkers, but the problem is it's sort of the people who come to the profession,
Mhm.
and I don't know what you do to turn off that. My own, even I'm retired now, but I can't turn it off very well, and so yeah, it's a problem. But I think it's the common. I think burnout is a big umbrella, and I think every person who has physician burnout's different. But I think a common thread, perhaps I've never seen a study, but I bet you find out the great majority of people with physician burnout are overworkers.
Mhm.
And
Mhm.
so it's sort of the common thread. And it would be nice to be able to treat that common thread. And I think education is really the only way to do that.
So, if there was a core curriculum in medical school to address burnout, tell us some of the components or content that it would have to have.
Uh-huh. Well, again, I think it should be led by practitioners. In my area, I didn't, of course, it was way before, I didn't really talk to them about this, but they certainly were very, very open to instructing medical students. And so I think that they would be available to do it. I think they need to introduce the concept of burnout, first of all, what it is, what the risk factors are, why you're at risk for this, and then talk about some of the underlying causes such as substance abuse, family issues. The fact of overwork certainly would be a big part of it. Talk about what the preventative strategies are in terms of access to mental health therapy, in terms of being a well-rounded person, exercise, nutrition, things like that. So, and then the bottom line is to just throughout the course be talking about the fact that if you want to be an excellent clinician, you need to take excellent care of your own mental health. So I think that there's a lot that could load this course throughout the clinical years of medical school.
We're talking to William Lynes, he's a urologist, and today's Kevin MD article is teaching medical students what it is really like to be a physician. William, let's end, as we always do, with some take-home messages they want to share with the Kevin MD audience.
I think that we have a problem, healthcare in America, just in general. We are spending more than any other developed country, and we're getting less results. And I think a big component of it is that we have a mentally ill workforce. And that mental illness is termed physician burnout. And so I think that we should be willing to commit a large chunk of financial and time on preventing that. And I think that the way to do that is by education that begins in medical school, and it's an institutional commitment. And it would basically teach medical students that in order to be excellent clinicians, you need to take excellent care of your mental health.
William, thank you again for sharing your perspective and insight. Thanks again for coming back
Okay,
on the
Kevin,
show.
thank you. Yeah, thank you.